Hi there, I'm Dr. Rombach, one of the co-founders of Equicore Concepts. This presentation will guide you through the research behind the Equiband Pro System and how the band system can be used appropriately, both for general conditioning and for specific conditions in equine clinical rehabilitation. The Equiband system was in design for over 2 years. It was first marketed in 2011 after extensive research and development into optimal materials for both the saddle pad and the unique resistance band that make up the full product. Since the system was first launched into the market of equine rehab, there's been much interest from both clinical and academic institutions into the application and benefits of resistant band training in equine conditioning and movement retraining. The system is now regularly cited in clinical research related to equine rehabilitation, and it is also readily integrated into equine sports medicine throughout the world. The concept of the use of resistance band training for core strengthening and conditioning came about when it became clear that the majority of horses that presented for clinical sports medicine evaluation were given specific core strengthening exercises as part of their rehabilitation program. Static exercises are very beneficial, but the essence of return to athletic performance depended on the improved dynamic core strength. In other words, the horses had to retrain movement towards an optimal posture, particularly for work under saddle. This is how the Equiband system evolved, as a unique and specific means of activating the horse's core musculature during movement. The core can be described as the bridge between the trunk of the horse, or the axial skeleton, and the limbs, or the appendicular system. The key function of the core system is to stabilize the spine during movement. This is achieved by a synergistic interaction between deep muscles that attach directly to the spine, also known as perivertebral muscles, and superficial muscles, including the abdominal and oblique muscles, that function to support and stabilize the trunk during movement. Throughout the spine and also in the appendicular system, each joint complex has its own complex of muscles that stabilize these joints during movement. So why is core strength so important? In a nutshell, core muscles stabilize joint complexes during movement. If core muscle function is inefficient due to injury, overwork, and other causes, the affected anatomical area becomes unstable, which will eventually lead to pain or injury. The key aim of the Equiband system is to improve core muscle activation through continuous stimulus from the body to the brain, resulting in changes in motor output, or simply put, changes in muscle function. For any system, whether this is human or animal, symmetry of movement is always desired. Where there is a lack of symmetry of movement, compensatory movements will result, as the brain will continue to guide the movement of the body as best as possible, recruiting whichever muscle groups or motor pathways that are available. No matter how adept we are as riders, it's impossible to give a continuous effective stimulus to the core muscles. In addition, when the brain is moving the body through a compensatory pathway, it's challenging to correct that neural pathway that is often barely perceptible in the saddle, especially when subtle or in early stages of compensation. By applying a slight constant stimulus to both sides of the core muscles, symmetry of movement is facilitated. In other words, the Equiband promotes the development of optimal neural pathways or connections between the brain and the body. The central nervous system possesses a characteristic of plasticity, which means that it can adapt neural pathways according to how and where external stimuli are received. This involves tapping into the proprioceptive system. This is the innate sense of body position and self-movement. The proprioceptive system is regulated by the brain through constant feedback between sensory receptors that are found throughout the body and the brain itself. Images here show the superficial core muscles that are directly involved with the provision of dynamic stability, the long and transverse abdominal muscles, and the internal and external oblique muscles. The deep core system that supports the spine during movement, which is a concept known as dynamic stability, consists of a number of different muscles that attach directly to the vertebrae of the spine. Dorsally or directly above the spine, multifidus runs along the entire length of the spinal column. Multifidus is made up of 5 different fascicles in 3 different layers and attaches at each spinal level between the dorsal processes or top of the vertebrae and directly onto the facet joint or intervertebral joint at up to 4 intervertebral levels. The most forward or cranial attachment of multifidus is at the second vertebra of the neck, and the most caudal attachment in the lower back is at the last vertebra of the lumbar spine. After this, multifidus blends into the sacrocaudalis or tail head muscles. On the lower or ventral aspect of the spine, longus coeli supports the neck from the first vertebra to the 5th or 6th thoracic vertebra. There is some individual variation. Like multifidus, longus coeli in the neck or in the cervical portion is made up of 5 different muscle fascicles that are bundled into 3 layers. Longus coeli attaches between the ventral or lower aspect of the vertebral body and the transverse processes of up to 4 vertebral bodies. Then, in the lower back, the psoas muscles provide direct support for the ventral or lower aspect of the lumbar spine. Psoas is divided into 2 muscles, minor and major. Psoas major blends with the iliacus muscle to attach onto the medial or inner side of the femur. Do note that there is no direct support directly underneath or ventral to the thoracic spine between the levels of more or less T7 and T17. The perivertebral muscles are made up of predominantly type 1 muscle fibers, which allow these muscles to provide stability and support over a sustained period of time. These muscles thus control stability of the trunk and the back, as opposed to creating primary movement. But again, there is no direct support underneath or ventral to the thoracic spine in the area where the rider sits. In addition, this area is weighed down by the viscera and internal organs. As such, it's imperative that the deep and especially superficial core muscles function optimally to provide stability during movement. In any process of injury, inflammation and pain lead to adapted movement. The brain recruits a different neural pathway to avoid this pain. Different muscles are now involved with the new compensatory movement patterns. Initially, this strategy is ideal to avoid pain or avoid further injury to a body part. Over time, however, this compensatory movement is no longer ideal as it results in suboptimal loading of the joints. Remember, muscles move joints. It's also really important to understand that once pain is resolved, compensatory movements do not automatically revert to original movement patterns. In the case of the stabilizing muscles of the spine, for example, the property of stability is lost when there is an injury or a lesion, such as kissing spines, for example. There is no longer a controlled stability during movement. This results in excessive micromotion of the joints, which sets up the spinal segment for issues such as arthritic changes, as joint movement is no longer adequately controlled. Another effect is that of neurogenic atrophy, or atrophy due to loss of use. As mentioned, original movement patterns or original muscle activation patterns no longer function as they should. These muscles that no longer function normally lose tone and texture, which is known as atrophy or muscle wastage. This can also be clearly seen with injuries to the distal limb. For example, in the horse in the image in the lower right side, the horse suffered a severe injury to the complex of the left hock. If you look at the musculature over the hindquarters, neurogenic atrophy is clearly visible. From a movement retraining perspective, the focus needs to include reactivation of the neural pathways between the brain and, in this case, the hindquarter musculature. Similarly, it's been shown that horses with lesions in the spine show measurable neurogenic atrophy of the core stabilizing muscles in the affected region. This leads to a loss of focal stability and predisposes the area to either re-injury or a new secondary injury. This is where dynamic movement retraining comes into play. After combined decades in clinical practice, the Equicore Concepts team of licensed therapists and veterinarians identified the need for a resistance band system that could be used safely and effectively in core strength training and retraining. Following more than 2 years of research and development, the Equiband Pro System was finally officially launched. Previously used human resistance band was found to have less proprioceptive effect due to the smoothness of the bands. The resistance band of the Equiband system has a unique texture, and together with a specifically devised tension, these bands offer optimal and constant proprioceptive input. The saddle pad was designed with multiple layers of materials and shaped in such a way that it offers additional clearance over the wither and lower back regions. This is important as pressure from a pad onto the spine is undesirable for many reasons. The system is supported with clear instructions for use and specific attention to precautions during use, as safety and clinical reasons for use are of unquestionable importance. To date, the Equiband system is the only equine resistance band system to have gone independent, peer-reviewed research. A study in 2014 evaluated the kinematic effect of horses with the Equiband system over a 6-week period. Interestingly, this is the only study that looked at the effect of the use of the Equiband system on horses that were clinically diagnosed with a lameness. Although the use of the system did not change the observed grade lameness, symmetry of movement and spinal motion did show statistically significant changes. At the walk, dorsoventral or up-down motion of the thoracolumbar spine, so the lower back, was increased when using both bands and when using the hindquarter band only. At the trot, the dorsoventral or up-down motion and mediolateral or side-to-side motion of the lower back was decreased, indicating a greater stability of the thoracolumbar spine during movement. Another study, carried out independently at the Royal Veterinary College in the United Kingdom, used motion sensors to collect data on changes in 3-dimensional movement of the thoracolumbar spine over a 4-week period. Measurements were taken at trot on a hard surface in a straight line and in trot on both reins during lunging on a soft surface. Overall, the 3-dimensional motion in the thoracolumbar spine showed a significant reduction, indicating a potential improvement in spinal stability during movement. One of the pitfalls of this study was the lack of a control group, and this was acknowledged by the team of researchers. 2 veterinary physiotherapists in Sweden carried out a kinematic study of symmetry and movement of the thoracolumbar spine with use of the hindquarter Equiband only. Differences were measured in 3 conditions, using both the girth and the hindquarter band, using only a girth, and without either a girth or the hindquarter band. Movement was evaluated during in-hand walk and trot on a firm surface. Overall, the statistical analysis identified an increase in stability, so a reduced range of motion in the lumbar area and at the 12th thoracic vertebra with the use of the hindquarter band. A study from the Orthopedic Research Center of the College of Veterinary Medicine at Colorado State University highlighted the relationship between the cross-sectional size of multifidus in the lower back with a reduced postural sway, in other words, an increased stability in standing, after a 12-week intervention of ground-based and dynamic core strengthening exercises, which included use of the Equiband system. Research from the University of Tennessee used a crossover study design to investigate activation of longissimus dorsi and rectus abdominis muscles using surface electromyography. 6 horses were walked and trotted in hand and over poles, both without and with the abdominal and hindquarter equibands. Both conditions of the poles and the equibands increased muscle activation. Of note was that the Equiband increased rectus abdominis muscle activation on both sides, and this was seen to be significant on the left side in this group of horses. Rectus abdominis muscle function is a key component of core strength and dynamic stability. To the left, you see a video of a horse who presented with a chronic low-grade unblockable irregularity on the left front leg. Using kinesiological testing, the abdominal group was identified as being weak. In the video on the right, the abdominal Equiband was added to support the abdominal muscle group, and the horse was re-evaluated. The symmetry of movement improved visibly, as did stride length and stride regularity. If the core is dysfunctional, a compensatory movement pattern will set up over time, which can lead to later injury or pathology. From a clinical perspective, using the Equiband system can be an interesting way to evaluate changes in regularity or symmetry of movement. Using a basic anatomical marker set is useful for a better visual perspective. In the video on the left, the horse shows an irregularity of movement with the right front leg. Adding the abdominal Equiband, this irregularity is much reduced. Again, core function is key for optimal symmetry of movement. The Equiband system is widely used in different rehabilitation settings, especially for horses who are undergoing either conservative or surgical treatment for kissing spines. This is a horse who underwent surgery at multiple spinal levels to address crowding of the dorsal processes in the thoracolumbar spine. Part of the rehabilitation program involved regular work in an underwater treadmill, and the Equiband system was used during these sessions. This horse was also in a specific groundwork program that included use of the abdominal and hindquarter bands of the Equiband system. The Online Academy of Equine Sciences course on evidence-based rehabilitation for kissing spines includes very specific information on the how and when to introduce the Equiband system during the different phases of rehabilitation following kissing spine diagnosis and treatment. The Equiband system is equally useful in general conditioning. In these videos, it's evident how the posture of the horse is altered with use of the full Equiband system in an underwater treadmill. Clinical reasoning is always essential. This video shows a show jumper who's returning to work after a chronic issue with a suspensory ligament. By adding the abdominal Equiband, the rider reported that the horse felt more symmetrical in movement and more able to engage the right hind leg during exercise, specifically in approach to and after landing over fences and in flying changes to both directions. The original suspensory ligament injury was on the right hind limb. This video shows the same horse, now using the abdominal band and a very loose-fitting hindquarter band. With this combination, the rider reported feeling an increase in stability on landing over fences. This is another example where the Equiband system can be used in specific biomechanical conditioning and movement retraining programs. The canter poles here are set further apart than in standard distances. The horse is using the abdominal Equiband, and with a greater width between poles, a larger excursion is promoted, especially with use of the abdominal Equiband. The wide triple bar jump at the end increases the vestibule. This is an example of a combination of different dynamic proprioceptive stimuli. When first introducing the Equiband system, start by evaluating the horse's posture at rest. Watch for any weak posture, so standing hollow-backed and with hind limbs camped out, so in a thoracolumbar extension. Stability tests are very useful if these can be included, as if a system is not stable in standing, it will not be stable in movement. Different forms of stability testing are shown in the longer courses that Online Academy of Equine Science offers. These are the courses in rehabilitation for kissing spine and core strength conditioning. Find the horse's optimal resting posture through an abdominal lift, as shown in the top images on the left-hand side. Always fit the abdominal and hind quarter bands with the horse in its optimal resting posture. Understanding the when to and how to is of great importance when introducing the Equiband system. After fitting each band separately, starting with the abdominal band, walk and trot the horse in hand, and then lunge the horse at walk-trot canter. If the Equiband system is going to be used under saddle, then test the system with the rider up. The band tension may need to be adjusted after the initial movement, but it should not need to be changed as the band does not stretch over time. It retains its original tension. Do reevaluate after about 2 weeks of use. As the horse's posture improves, the bands may appear more slack, and then you can adjust as necessary. Start by using the bands on a daily basis, little and often. Initially, reduce the horse's work time by at least 50% and allow for regular rest breaks during training. If you only want to use the band system for part of the session, use it at the start of your session. Don't add bands when the horse is already fatigued. Over a period of about 3 to 4 weeks, the bands can be used throughout the full training session. But always watch for the horse's reactions. The horse will fatigue with introduction of each of the bands. Some horses prefer only one band, some work well with both, so let the horse guide you in your choice. It's important to use the abdominal band first and then add the hind quarter band later. With use of the hind quarter band only, the horse can still brace the lower back, which is counterproductive when what we're trying to achieve is thoracolumbar or lower back flexion. Most importantly, when the band system is fitted, watch for changes in soundness. Many horses with subclinical lameness will become overtly irregular in movement when they are obliged to move symmetrically through application of the bands. In this case, cease the use and refer to the primary veterinarian. Once the clinical issue is addressed, the band system can be reintroduced into the rehab program under veterinary guidance. In cases with spinal dysfunction, such as kissing spines, or for horses who have injuries to soft tissues of the distal limbs, the rider or trainer is often reduced to working in hand only for a prolonged period of time. This is an example of a horse who was diagnosed with kissing spines and where the Equiband system was used during in-hand phases of rehabilitation. The system is also really useful for horses who are on stable rest following injury or surgery. For the hand walking portion of the rehab program, use of the Equiband system is strongly suggested, along a series of ground-based core strengthening exercises. Horses who've undergone colic surgery benefit from use of the band system in their recovery program. For these cases, a full program of ground-based exercises and introduction to movement retraining is available through Equicore Concepts. This can be shared with your primary veterinarian. You can contact the Equicore office for more information. Many horses with lower back issues and general poor posture or suboptimal core strength will develop secondary issues in the lower neck. This is similar to what is seen in the human back neck pain patient population. The spinal stabilizing muscles are of equal importance in the neck as in the back of the horse. So the Equiband system has developed an additional piece of equipment that can be used together with the abdominal band. This is the scapulothoracic band. It's only sold through licensed professionals and should only be used under licensed professional guidance. Common questions that are asked when first introducing the Equiband system include the question about the abdominal band slipping back and the hindquarter band riding up. If the pad is too long, so if it's too large a size pad for the size of the horse, the abdominal band will sit too far back. It may also be too loose, so tension should be rechecked. Sometimes the band will slip back with the use of a surcingle, and that's often corrected when the horse is worked in hand using the saddle instead of a surcingle. When the hindquarter band slips up, the pad is either too long or too large for the size of horse, or the band tension again is too loose. When using a roller or surcingle, ensure that the Velcro straps of the saddle pad are securely connected to the roller or surcingle, and most important that this is sufficiently tightened to prevent the whole system from slipping back. Again, some horses will do better with the use of a saddle without the stirrups on the back, even for in-hand only work, as opposed to using the surcingle with the Equiband system. It's strongly suggested that the Equiband system is used only in conjunction with a program of ground-based exercises, which should be carried out before and not after work. Using baited exercises, which are activations and not stretches, the activation of the core muscles prepare the horse for core engagement during locomotion. These various exercises are fully described in other online Academy of Equine Science courses. So a few words of caution when using the Equiband system. First, do not use side reins when using either the abdominal or hindquarter bands or both. Side reins inhibit cervicothoracic or lower neck motion and thus prevent postural strengthening of the lower neck, where the deep lower neck muscles form part of the spinal stability muscles. Horses with ulcers or suspicion of ulcers should not use the band system until this issue has been addressed clinically. On a practical note, do not use fly spray on, around, or over the bands, as this may compromise the integrity of the resistance band material. The Equiband system was launched globally in 2011 as the first commercially available equine resistant band system for horse core conditioning, and it's the only system that's undergone independent peer-reviewed research. It's only distributed primarily through veterinarians and licensed professionals, and it's especially not promoted as a training aid for general use. A number of cheap copies have recently appeared on the open market. These copied products are made with very different and suboptimal materials, and their effects are not researched. Even so, these manufacturers claim to offer the same benefits as the original Equiband system, but the statements made on these products are purely extrapolated from research with the Equiband system and thus invalid. More concerning is the fact that lay people sell these copied products without any understanding of the clinical reasoning required when evaluating whether a resistance band system is actually appropriate for the horse in question. So for your horse's well-being, do consider the source of the product that you are intending to use. A few closing words on use of the Equiband system. Firstly, always work with a licensed professional who uses clinical evaluation to confirm whether this Equiband system is indeed appropriate for your horse. particularly during rehabilitation. Professional guidance is essential. Include a program of ground-based exercises with the use of your band system. These exercises only take 5 to 10 minutes a day and always carry them out before work. Finally, for optimal fit, have your Equiband system fitted by a veterinarian or licensed professional. This will ensure safe and appropriate use of the Equiband system for your horse.